Good afternoon, everyone. Welcome to our November Population Health LAN. I'm excited for the next two Learning in Action networks or the times we get together, but I'm also kind of sad. We've been doing this for how long now, and come January, we won't be doing this. And so I'm gonna have this emptiness on the second Tuesday. You guys may feel like, oh, a break. I will feel like a break too, but I'll miss seeing your faces on a regular.
I'm about to just get naked.
I'll just mute that one.
I don't know. I'm curious to hear more about that.
Funny. All right. Well, Tina, am I going to turn it over to you to kick us off, or is it Wendy?
Nope, I'll start us off. So yeah, it didn't occur to me as we go into next year, we won't have these regular Tuesdays. And so I think it's a really good time because we're going to start talking today, and we have been a little bit, but we're going to talk about sustainability and specifically planning for sustainability. And we're going to start working through the worksheet that's going to be your homework. So the homework template that you received, hopefully you have that handy because I'm going to ask you to pull that up shortly. Our usual agenda today, we're going to do a review of improvement data where we're at. We're going to do a homework debrief, and then we're going to talk more about concepts in sustainability and planning for sustainability. And that's where we'll pull out that homework template and start working through that. So the learning objectives for today are to describe sustainability and why it's important, to identify key domains to plan for sustaining gains, and then 3, to plan for sustaining your important improvement work. So before we get into that, I'll just go through this improvement data pretty quickly today. Lots of good news in here. Hemoglobin A1C poor control, we have a median of 28% with a range between 8 and 38%, and half of teams are between 21 and 34%. The population, as we've talked about, varies quite widely between teams, and we do have 3 teams this month that have a signal of improvement in their data. So let's take a look at that. Here are the 11 teams that have data. We can see there's improvement with Cooley, CVCH, and Moses Lake Community Health. It's not always apparent by just looking at these tiny little charts, so you really do have to dig in and expand the axis. And so I have applied the run chart rules and confirmed that there's a signal there. So really good work. Congratulations. And I think thinking about the concepts we're going to talk about today, if you've reach some level of improvement, particularly if it's where you set your goal, these concepts are going to be really applicable to think about how do we not backslide? How do we maintain this gain or maintain this new level of performance? Depression screening and follow-up, we have a median of 15 teams that reported, and the median is 52%. The range is quite wide, between 2 and 91%. So that's pretty big range. Half of teams are between 23% and 86%. Quite wide variation in the denominator, all the way from 6, which is a really small population. Not always great for a denominator for quality improvement purposes, because sometimes you don't think about sort of the system level things. So if that is your team, think about how you can scale up your denominator all the way to 2,600, a little over 2,600 as a denominator, which is quite big for a one-year improvement initiative. So as you're introducing changes, as you're testing changes, implementing changes in this short time period for that many patients, you may not see the impact on the data for that population. So just something to keep in mind. That being said, we do have 4 teams that have a signal of improvement in this measure. Oopsies, did I advance? No. Okay, so we've got CBHA, we've got the 15 teams that are reporting lots of variability. As you can see, we have some very high performing organizations in this cohort. Moses Lake Community Health, Confluence, and CBHA are all observing a median of 91%. And the 4 teams that have a signal are CBHA, the Center for Drug and Alcohol Treatment, CVCH, and Renew, which was formerly Grant. So these are really great results. Kudos. There's a few others that are really close to observing improvement. On the next measure, we actually put in a lighter green arrow to indicate that. We didn't do that with this one, but we will for next time. So there's lots of promising direction in some of the data here. Some of you just need another observation, and it might confirm that signal of improvement. The last one is median depressive disorder monitoring. So there's 13 teams reporting. The median is 64%. The range is between 14 and 82%, and half of teams are between 30 and 75%. Big range in the denominator again. And this time we have 6 teams that have a signal of improvement, which is really cool. You can see all those green arrows, and then we have the lighter green arrows for some teams that are really getting close to showing a signal of improvement, but this is looking really good. Catholic Charities, Columbia Basin Family Medicine, we've got Children's Home Society, Cooley, Confluence, and Columbia Valley Community Health that all have signals of improvement. There is still quite a bit of variation across this measure. So take a look at some of the peer leaders in that group, who's doing the best, and see what you might be able to learn from them. I'm just going to really quickly cover some of the self-selected measures, but are there any questions for other teams, questions for your peers, observations or comments anyone wants to make? Anyone pleased?
I think one thing with this work is it's not necessarily that we're not monitoring things, it's we're not reporting it is the problem. And getting those paper forms into the computer, getting the computer with the right check mark, and then getting that to the right place. This has been more of the problem than setting up things than actually just asking people about like administering the PHQ. So it's a lot of staff training about administrating it well, and then a lot of staff training on how to get it counted in the right spot.
So I think what I've heard is there's lots of different changes and drivers of change that need to be introduced to move some of this data. Is that kind of what you're alluding to, Ton, or something different?
And sometimes, yeah. And sometimes the idea of like we're monitoring for depression, we're sold on that idea, we're doing that, except for it's not showing up anywhere because we don't have all the workflows put out well.
Yeah. And now I kind of want to extend that thought, because as we're starting to think about sustainability, we're going to be thinking about, now we've introduced a whole bunch of changes and we are monitoring it, we're observing it. How do we make sure we don't regress? How do we hold on to those gains? And that's kind of what we're going to talk about today. Self-selected measures, quite a few self-selected measures or optional measures. We've called these 2. Oopsies, moving forward. I've only indicated where there's a signal of improvement where only a single team is reporting on these measures, only because it stabilizes the denominator. But there are obviously follow-up after ED visits. Someone is driving an improvement in there. We do have a signal for substance use disorder treatment penetration, serious mental illness. So there's a number of optional measures that do have signals of improvement. If that's you, congratulations. Similarly, for diabetes measures, I've only indicated the one where we have one team, but there's clearly a number of other measures that are looking really good, and teams that are likely seeing improvement there. So this one here, and also diabetes eye exam up here. Okay, and I think that flows really nicely into our homework from last period, which was really to connect, what do you connect to with this work? And I'm going to turn it over to Wendy.
Thank you. And you're going to change slides for me, Tina?
Yes.
All right. So we're going to do a round robin. And just as a reminder, we asked you to kind of give us an idea of what keeps you going during a difficult period or hard day, which I'm sure there's been a number of those over the last year and a half. So 1 minute to kind of describe what keeps you going, what keeps your team going, and we'll start with the Center for Alcohol and Drug Treatment. Who's willing to share?
I got the long straw, so I get to.
Oh, awesome. I love it.
So we were talking about a symbol or something that made sense to us that would describe how we feel on a day-to-day basis and going through this journey. And so it came back to our logo, which you can see right next to our name. So that is a house, and part of it is dark and part of it is light. And so we talked about how, we're looking at the big picture of what we need to do, but, we end up in this house and we're bumping into each other and trying to figure out the difference between data and clinical and all this good stuff. And, how as we progressed through, it came to light and our numbers started to show and we got workflows in order. So we keep thinking about, the positive outcomes for the patients and being able to measure things for us has been a really big deal because we haven't been good about that. So, we work as a team. We're not alone in the process. And, we ask our patients every day to go through difficult processes and to do things that they can't really see the light side of the house, that they're in the dark. And so, but we ask them to trust us and to go through a process, and then eventually they start to see the light, and then the room becomes very, very light for them. And so we were talking about how that's the process that we went through is trying to go, what do we have to do? Like, I don't even know why we're measuring that, and just really being in the dark, but just going through the process with the rest of all of you and internally with our team. And so, we just kept on going. And now that we're at the end, we want to continue to measure the things that we have put into place. And we're looking at this as something that has taught us a process that when we decide to do any sort of quality improvement, that we're going to be able to use the things that we've learned during this journey to put that into place and be able to go back and measure it and know that we're either at mark or, below, above where we're at and where we need to improve. So that's what we went with.
Thank you for that story. That is awesome. It's kind of, what do they say? You've seen the light. There's no going back. Thanks, Loretta. And I really like how you talked about the kind of the parallel processes that patients go through, because it's almost like they're testing changes for themselves and then having to apply what worked, figure that out, and then figure out how to sustain it. So it's just interesting because you can really speak from experience how hard that changes. So thanks for sharing that. All right. Cooley, you're up next. Who's your representative?
Hi. Can you hear me okay?
Hey, yep.
Hey, this is Shoshana. So we had a couple different answers when we were brainstorming, going through our homework. I'll just go through them really quickly. So some of the items that keeps us going during a difficult period or a hard day is the improvement trends of our data for our measures. They have been really helpful for our team to keep us motivated to continue with our improvement efforts. Just seeing the trends going in the right directions has been a big help for us. Also, going home to our families each night provides a great refresh to help get through a difficult period or hard day. That's always nice to have that refresh. Our organization also has a staff shout out board, and that's for staff to recognize another staff member who have been doing a fabulous job lately, going above and beyond for patients and staff, etc. And it's on our employee staff hallway where people can look at it throughout the day as they're walking by. And then also, we feel that having an amazing team to share the work with each day makes it easier to get through our hard days as well. Thank you.
So you really, it sounds like, rely on each other and build each other up, that's a big deal. That's awesome. All right, thanks for sharing that. Catholic Charities. Who's your representative? Anyone on from Catholic Charities?
They're on, they're probably just trying to find their mute.
Okay.
Yes? No?
Hey, we can hear you.
Okay, sorry. We were having some issues with our microphone, so we had to switch it to a different one. We're all here in the same room.
Okay, cool. All right.
Yeah, we kind of said the same thing in terms of having support of each other. So we have lots of different teams or departments at Catholic Charities, but everybody is very supportive of other teams, and that's super helpful. Even though, you know, the crisis team might be working on something a little bit different or focused than the outpatient team or the medical team, we're all working with the same clients. And so just having that in common and kind of being there for each other helps. We have smaller teams than maybe some of the other organizations. And so that kind of lets us be a little bit closer, I guess, in terms of we're kind of like family to each other. We're supportive. We try to get out of the office or do things to get a change of scenery, like go have lunch or do something just not work related.
Yeah.
As a group. So that helps too sometimes, just to kind of get a brain refresher.
Yeah. So you have a work family. And I like the idea. Sometimes you just need to take a mental break from just even in the middle of the day to get some fresh air. It's a good one. All right. Thanks for sharing that. Next, Moses Lake. Who's sharing from Moses Lake?
Hi, this is Heather.
Hey, Heather.
Hi, sorry, I was having some computer technical difficulties. So I also listed a lot of stuff out that we do here at MLCHC internally. That I really think the theme of what we do, and I heard it from our team members, were that they just really appreciate working for an organization that has an administrative staff that would work to implement so many different programs that really caters to all the different appreciation styles. You know, not everybody wants their names on a big billboard, but not everybody else wants a little sticky note given to them. And so we talked about the well-rounded, versatile ways that we build each other up as team members. And so it begins with our High Five program, which is an internal program that's ran through our HR department, that anybody can give somebody a high five, which you write the reason why you want to give somebody a high five and turn it into HR. And those are presented at different staff meetings, where we have a smaller program called our Caught in the Act of Service program, which is another internal program, but this is ran from a committee of just staff members called our service ambassadors. And that's where you can just write like Caught in the Act of Service of holding a door open, or hey, that reminder email, just those small things that people do for each other that helps our day really go much smoother. And so those are just little cards that we have scattered around the clinic that anybody and everybody can pick up and give to them, each other, or even give them to a patient. We do patient satisfaction surveys through a third party. So Crossroads does this third party survey company does patient satisfaction surveys, and we get the comments back, and we go through both areas of improvement and success stories and kind of share those with the team members each quarter for all of our medical, dental, behavioral health providers and pharmacy staff. And so they can really see how they're making an impact on patients' lives. We also have a very family-friendly work environment. A lot of us bring our families here to get healthcare and dental care services, and it's super encouraged. And it's always fun when staff members bring their kids into the clinic and they come around and meet everybody. And so it's highly encouraged. And then, you know, going home to our family and friends and our pets at night. Another thing that we've recently implemented is the consistent check-ins via morning huddles, department meetings, and staff meetings that had been very prominent in the medical department. But ever since this population health LAN has been going, our medical department has really talked about the benefits of that, and including, you know, our frontline staff, because they are technically a part of the clinical team. And so everybody does morning huddles now, even our referrals department and our dental department and, you know, our eligibility department, they huddle in the morning now, just because they've seen the great impact that it's had on the medical department in opening up the lines of communications. Our administrative staff are committed to doing lunch and learns and different appreciation days. And so we have suggestion boxes. And so since right now is open enrollment time, our HR department is extremely busy doing all kinds of lunch and learns to really educate the staff about the changing environments. And so I think just open communication and being well connected are really just what makes us all our days a little bit better when we're faced with such difficulties with the pandemic. So thank you.
Excellent. Oh, I love all the different ideas and all of the brainstorming everybody did with their teams on this. This is awesome. All right, Mid Valley, you're next.
There, this is Diana with Mid Valley, and we came up with a really good administrative support team. Was one of their biggest factors. Myself included, we always are able to go into our administrative door, shut it, and just vent. And sometimes there are days where you just need to go in and scream. So they don't criticize what we're saying. They don't judge what we're saying. And we'll just listen and take everything in, and often provide feedback and project the issue in a different light. Sometimes, spin that so that you can see it in a different way. And that usually helps take that frustration out of the loop and pushes everybody back into a better direction and more positive direction. I added that we do get some feedback from our patients, of course, and that's always good to hear nice feedback from your patients that they're happy with either a new look in the clinic or, hey, I got some great communication today and my doctors were on par, my appointment was on time, those kinds of things. Those little things really help keep you going and saying, oh, hey, we are doing something good, even though most days it doesn't feel like it. So that's what did it for us.
All right, thanks, Diana. I think that's such a good point too, of just being able to vent and feel accepted and safe in your venting, because it does need to happen sometimes. All right, family health centers. Who's going to speak up?
This is Tom from Family Health Centers. We have what we call Caught in the Act, and this is run by our customer service manager, and we have it on our intranet form, so we can all, and anyone from anywhere in the entire organization could put in easily. It's a form. It takes like 5 minutes to fill out or less, and say what we've seen that someone was extraordinarily helpful, went out of the way to help someone. It could be things like they helped the patient, somebody fell on the front walk, somebody helped them up, or it can be helpful with workflow. And then we are highlighting these on our daily huddle hot sheet that everyone can read, besides putting out a newsletter. And then we have an intranet, like a news feed of sorts, kind of like social media news feed that we have where we put up different announcements and we show staff success. For example, if someone completes our MA program and they're now a certified MA, or they complete our dental assistant training program, we celebrate them on this news feed. And then feeding people, you can't feed people enough. So whether it's lunches or whether it's getting snack boxes, and we're not just talking about like bringing in donuts, like actually giving people stuff that like they could use for a lunch and not feel gross afterwards because they got something nutritious in them, and having some of those healthful snacks posted for the busy clinic days that we've had.
All right, so no donuts, which is probably good.
Oh, there's plenty of donuts going on too. That's not what I'm talking about here.
And Heather said she loves your hot sheet, which I've never heard it called that either, but that's awesome because it seems like it sets the tone to make it go quick. Like this is a quick huddle and we're moving on. So it's a hot sheet. I love that. All right, next one. All right.
That's the end of the slides, yeah.
All right, so I know we're missing a couple. Is there anyone from Confluence that wants to share what they're doing on a tough day?
This is Stephen Johnson. Can you hear me okay?
Yeah, hey, Stephen.
Yeah, sorry for not getting that in time to be included in this, but I think that on tough days, just breaking it down for people, let's just get through today has kind of been the theme lately. We can do today and we'll get through today, so let's figure out how to do that is helpful. And then I like to say that the why motivates the try. So if we can help people remember why we work in healthcare and why we love working in healthcare and why we're trying to do the things that we're doing that can help motivate the effort, the try when things get tough or aren't working like they're supposed to.
I like that. The why motivates the try. I'm going to remember that one. All right, Children's Home Society. Anyone have something to share there? What do you do?
Yeah, so our team just kind of talked more about, thinking everything kind of related to back to our clients. So thinking about like small successes that we've had with clients. Also talked about clients' positive energy and or even our team and the energy that we bring to each other and being a support to one another, especially during difficult times.
I really like that too. That's such a great way. I think a few people mentioned that, how just hearing patient successes, hearing back from patients, how you appreciate that makes such a big difference in getting through that day. Anyone else that I missed that wants to share?
CVCH, I'm sending in from ours. For us, we have connected purpose stories, so kind of very similar stories that really epitomize the mission from about patients that we share. We also have, during our main leadership meeting and all departmental meetings, we have a kudos and accomplishments kind of section that folks talk about running their half marathon, or we actually tie it to something that happened at the clinic. So other things that people have accomplished even outside of work, we add to that. And then we have the supervisors. If one employee wants to thank another, we actually have their supervisor write the thank you note to another staff member. So that kind of helps folks, again, kind of reminds them when they're having a hard day that people do appreciate them, their peers.
I love that, kind of bringing in stuff from the outside too, some of the accomplishments and kind of celebrating all of those as a team. It's a great, good one. Anyone else? Did I miss anybody? All right. Thank you all for sharing that. It was wonderful to hear. I feel motivated, and it's just so good to hear all of that from you all. So thank you so much for sharing. And Tina, I think I'm turning this back over to you for sustainability. Let's keep it going.
Okay. Very good. Okay, that was really great. I loved reading through those and hearing about a number of the things that you're doing to celebrate your team, and also that just you connect with. And I love some of those quotes and some of those ideas. We're going to talk about sustainability. Sometimes you've called this, it may be heard as holding gains, but it's really about doing work that will help lock in the progress that you've made. And to some extent, we've talked quite a bit about this actually, like when we apply quality improvement processes like measurement, like when we test and scale up changes over a wide variety of conditions, and also some of the change ideas that we've used embed these concepts. You might remember the reliability principles that Roger went over in May, like standardization, smoothing workflows, use cues and forcing functions. So in those cases where you've applied some of those concepts, sustainability is really baked in part. And so there's still a few other things that we can do, but this serves as a good foundation. And today we're going to walk through that planning sheet. So open up that planning sheet that Wendy sent out today, maybe, or Friday. And this is going to be the framework that we're going to work with. We're going to get as far as we can with it. And then I'll leave you to finish it with your teams. So at least we'll get a head start with it. And I just want to comment that sustainability concepts are usually focused on holding gains. So when we saw already that lots of teams have improvements, maybe they've reached goals, or maybe they're still on their way to goals, but not everyone will be at this place where they've reached that goal and they're necessarily ready to apply these concepts in that way. Nevertheless, you may have made some improvements and be halfway to where you want to be, but need a little more quality improvement work to reach that goal. You might maybe feel like you're stalled in some of your work and need to rekindle your quality planning and your quality improvement. Or you might have made some improvements and reached your goal, and now you're ready to make sure you don't slide back to previous performance. And so as we're thinking about the concepts today, I just want to make sure that no matter where you are in your quality journey, I'd invite you to think through this planning exercise based on where you are right now. So for example, if you're halfway to goal, think about what you need to hold in place so you don't backslide on progress. If you've been stalled, you might think about what quality improvements you had in the past and how you might make sure those are more resilient going forward or reliable. If you have achieved your goal for a measure, you'll want to apply these concepts to make sure that that progress doesn't disappear over time. And I already heard a few of you mention measurement. I heard a few other things that you want to make sure you maintain, like huddles. What else did I hear? Some small successes with clients. So thinking about some of those concepts too when you're planning for sustainability. So hopefully everyone's had an opportunity to open up the sustainability planning worksheet. Is there anybody who does not have that? I'm looking through faces. I think everyone's good. Just chat into the chat box if you don't, and Wendy can make sure she grabs that for you. We're going to start by thinking about what is the improvement work that you would like to sustain. And this is the first part of the planning worksheet. I'm going to give us 5 minutes to reflect. If you're with your team, do it with your team. If you're alone, you can do it alone. Just do the highlighted rows. So the first 2 rows, we are going to do what is the improvement work? Describe the improvement work. What is my role? What are my hopes for this improvement work? And what are my fears for this improvement work? So before I launch us off into the 5 minutes, what questions do you have? And Wendy's let us know that it's in the calendar invite. Okay, I'm going to give us 5 minutes. I'm going to monitor the team. That might be Catholic Charities. I know you're sitting as a team, so this might be a good amount of time. If you're sitting alone and you've completed the 4, I'd just invite you to keep going through that worksheet. We will reconvene in 5 minutes, and I am really keen to hear from at least 2 of you to hear what it is that you'd like to sustain. Okay, all clear? Okay, good. 5 minutes. This is just a 1-minute warning. Okay, that was 5 minutes. And now I'm really keen to hear from maybe about 2 groups. Just describe the improvement work you'd like to sustain, and what are your hopes for it, and what are some of your fears? So who's interested in sharing?
I'll jump in.
Share.
What the heck?
Great,
What is
thanks.
my role? I am the team quarterback. I'm responsible for setting the meetings and sometimes also for setting the tone of the meetings. Because sometimes I can come in dragging and somebody has to remind me that, yeah, there's more at stake than me. So completing the reports, working on the PDSAs, and learning the language of data, which has been very hard for me.
Very good. And is that the improvement work you'd like to sustain?
No, that's just my role. The work I'd like to, improvement work I'd like to sustain is that we would really work towards standardizing depression monitoring in the care of our folks with reporting a diagnosis of depression, to show the patient improvement or alert the counselor that it's going the other way. I would like to see that become our standard care, that the numbers would just be where confluences are. Yeah, that's quite enviable.
What are your hopes and fears, Paul?
My fears, that interest in improvement will wane over time. Team members will lose interest. Improvement will stop. And I just failed my team by not keeping things moving. We all need to see progress. And sometimes we just need to make sure that that's pointed out. And I like a lot of the ideas. In fact, I really want to talk to our team about instituting some of the ideas that were generated, how they get through a tough day or tough times, whatever. But that showing the entire staff the progress made, what these numbers mean, what this means for the care of our folks. And somebody said it perfectly when they said that these numbers reflect people receiving quality care. And sometimes I think with data, with me, sometimes I look at the numbers and I want to beat myself up because they're not where Paul wants them to be. But there are people receiving quality care behind the improvement numbers that we do have. And I don't want to lose sight of that. And I don't want to let anybody else lose sight of that either.
That's really,
we serve, not about us.
That's great, Paul. And I think that to some extent, it sounds to me like you described that you're still actively in the middle of a quality improvement phase. So you're still seeking to standardize depression screening and follow-up, depressive disorder monitoring. And so there's going to be specific things that you do that are quality improvement related, right? Like testing changes. And then when you've tested them, you have a high degree of belief in the changes, you're going to implement them. So when you're thinking about some of the domains that I'll talk about, they'll still be really relevant to holding on to some of your improvement infrastructure probably. But then when you do reach goal, think about them again in the lens of how, now that we've reached our goal, how can we hang on to it? How can we make it part of the organization? I know I asked for 2 teams and I'm going to have 2 teams. Go ahead. Who else would like to share? In 1 minute, hopefully.
So here at Family Health Centers, I'm the team-based care director, and we have, I don't know if we've done very much target improvement, but we've built the infrastructure that we can. So we have new centralized positions that are helping all the centers. We have new positions we've hired, in the last 3 months, we've hired 14 new people, and we're training staff this last quarter so that we're ready for 2022 for some more changes. So we're hoping with all this work that we're going to be able to hit 2022 and have some co-visits in. We're going to hit some of the quality metrics. And my fears are that we can only do so much at a time. Like, what are we going to focus on, and how are we going to keep a good schedule of focus on what we're going to, a good calendar of focus on this and focus on the next thing.
Thanks, Ton. Yeah, and I think, again, like, in part, you're very much still in an active improvement phase. And in the fulsome deck, I didn't include it today, but in the deck that you received, there's 2 extra slides that I don't cover that are the Duran trilogy. So in the Duran trilogy, they talk about 3 distinct phases: quality improvement, which has really been the focus of what we've been talking about; quality planning, which is also something we did very early on in setting up our improvement teams, in establishing our project or improvement charters, where we defined the gaps that we have, understand our population, set an aim, look at the measurement. But then there's also quality control. And that's where we've reached a level of performance, and we want to make sure that we hang on to that. So that is sometimes helpful. Sometimes teams tell me that's helpful to position themselves. And so again, as I'm just going to now share some of the 5 domains that we can think through for holding on to the gains, but I think these are equally relevant as you're seeking to maintain momentum for your quality improvement work, and you're seeking to continue to drive towards the targets that you set in your improvement charter. So let me move on to those. Okay, so these are the concepts that I've lined up for today. There are a lot of frameworks for sustainability, so these are just 5. And again, no matter where you are in your improvement journey, I think these will be widely applicable to you. And so the first concept is measurement, and that's something that we've already kind of covered a couple times. That's really important to be able to continue to observe for improvement, to make sure we reach our goal, but also when it comes to sustainability, to make sure we're hanging on to those gains and we're not backsliding. So it can be really tempting sometimes to reach the goal and then just move on to something else. Maybe it's just that you're tired, or maybe it's that there's a new improvement project that you've received. But if there's no eyes on the ball often drops, right? So for sustainability, it is best practice, to the extent that you can, automate this measurement. So it's not a lot of work, but certainly to continue to observe your key measures over time. And I've seen a lot of teams have success by posting these publicly for staff and patients to see, so that they're constantly visible and important. The second piece is ownership. And this is really about assigning a responsible individual or team to own the sustainability efforts. This is the person that's responsible for overseeing the sustainability domains, like all of these here, and making sure that, say, measurement continues and is continued to be monitored. They are also the conduit to, or the liaison to, the sponsor or senior leader. Which becomes a little more important, especially when we're talking about the next one, support for staff. So for staff to sustain a process or to continue with quality improvement, they'll need knowledge to do it. They'll need the skills to do it. When it's a new process, same thing. Any new actions, they'll need support and training, orientation to be able to do it. They'll need leadership to clear obstacles and also support to manage workload issues. So again, this can look like training, it can look like orientation for new hires, standard operating procedures that are easy to follow and are documented, so you don't have to rely on human memory, which is connected also to the last one. And it could be that the owner checks in with staff and relays information about workload to senior leaders. Communication is the fourth one. It's about being purposeful in how you make sure that staff and patients are kept apprised of the sustainability efforts. And likewise, how are you drawing information to help you understand sustainability? So the bi-directional communication. Now, ideally, staff will have been involved in testing and implementing the changes and will have some familiarity, but it's probably best never to assume that, and repeating communication is always described as best practice. So communicate, communicate, communicate. Likewise, deciding who is the audience. Is it other departments that might be impacted? Is it our sponsor or maybe our board? What information do they need? How can we deliver that information? And who is the best person to do that? Like opinion leaders in your organizations, people who are trusted. Often I've seen like professionals communicating with like professionals, though not always. And just thinking and being really careful and considerate about how and purposeful about how you are communicating. And then finally, hardwiring the change is about making it hard to do the wrong thing and easy to do the right thing. So these are, again, those reliability principles that Roger covered in May. And so you've got access to those slides and that recording, so take a look at that. But there's other things you can do, like making sure you remove the old way of working, which is often part of implementation. So when you're implementing, you want to make sure that you can't do it the old way anymore. So remove any forms, remove any protocol documents, standard operating procedures that exist, make it easy to do the right thing. So the new way of working is standardized also, queues, forcing functions, all those reliability principles are included. So that was a lot to cover. And hopefully though, this gives us a bit of a foundation about what can be used as a lens to plan for sustainability. My plan was to go through each of these domains together, but I think for right now, in the interest of time, we'll probably just be able to do one. And I think probably measurement, since it's first up, is a good one to tackle. So let's talk about this one. What I'm thinking we could do is, we've got the 2 questions in the template. What will success look like? And what do we need to continue measuring? So let us, let's see, we will do this by whiteboard. Sorry, I'm stalling my thinking. I'm just trying to find where the whiteboard is. Share slide, whiteboard, there we go. Okay, hopefully everyone can see that. The question was, what will success look like and what do we need to start or continue measuring? So let's just start writing. Enter the waiting room.
Use the whiteboard. Go to view options and you go down to annotate. And from there, you should be able to have a menu that allows you to type or draw or whatever you would want to do.
Is everyone seeing that? If you're not seeing that, just write it in the chat. Roger's asked a question in the chat, success for what? Great question, Roger. So when you think about where you are today, and we're coming to the close on the population health plan, in 1 year's time, what will success look like? And how will that then direct what you need to measure? Thanks, Ton. I saw that you're having some compatibility issues. So your entry is staff who believe their efforts make a difference to improved outcomes. I'll add that in there. Reaching our goal. Oops. Staff who believe, oh, you already added it. What else? I'm having some technical problems here. Is anyone seeing that disappear? This is not going well.
Yeah, it's all gone.
Hiring more staff and training them. I'm going to try and capture these in the chat. Let's just start using the chat now, okay? Sorry about that. That didn't work so well. Ton's already got it, so let me share my slides again. What will success look like in a year's time, and how will you know? So what do you need to continue measuring? Is everyone clear on the question? What questions do you have?
Are we talking specifically about the goal that we had outlined in the sustainability planner, or are we talking about something just more general about success in goals generally?
Yeah, great question. So I'm thinking, when I conceived of this, I was thinking the improvement that work that you want to sustain that you named off in the first box, what will success look like if you have sustained that in a year's time, say? And then that leads to, so what do you need to measure to know? Is that a little more clear? So we've got become routine, part of what we do, uniform workflows that generate consistent reporting, hiring more staff and training them so we can continue to maintain our current progress. Staff will know what is expected of them. For each patient encounter, surprises tend to throw people off. Patients will expect certain things from us and will pull instead of pushing for this work to be done. Whoa, this is going fast. I'm missing some. That line staff will believe in and see the value in the depression measure. And now you're off to another question. New staff during orientation will be given information on this process so everyone is aware of the importance. This is great. These are all really great entries. And so what will you continue to measure? How will you know? Feel free to just chat in because we only have a couple, or not chat in, but to just speak up because we only have a couple more minutes before I know when he's going to want to pull us off to evaluation. What will you measure?
The stuff we're measuring today, this is Dwight
Yes.
Center. I mean, we're going to keep measuring our PHQ-9 scores. And the part of that is the referral being done. That's what's going to let us know how we're doing is we keep measuring what we're measuring now, just maybe improve upon it as we learn more information, everything changes. That's what we need to continue to do, use the data to our advantage.
Very good. Yeah, totally agree. Okay. You know, we have only 4 minutes left, and I apologize that that exercise kind of went sideways with the whiteboard. But hopefully the worksheet that you've got will help you think through specific domains that you can be really thoughtful about to sustain the gains. So when you've reached a goal and you want to hold on to that performance, and Dwayne just talked about how we have to keep measuring exactly what we're measuring today. If we reach our goal on that, then we keep measuring it. So I totally agree with that as a strategy. And then we're not going to get to the rest of these together, but keep working through the worksheet. It'll guide you through aspects of ownership, who needs to be responsible, who needs to be involved, and how will you keep the organization, the leadership apprised of it. Support for staff. We have a really nice swim lane diagram here that Roger provided from Clinica. It's really clear on who does what and what they're working towards. Giving this clarity really helps people to do the right thing too. Thinking about support for staff, involving leadership to make sure that workload is managed, and making sure people have the knowledge and the skills to do the work. Communication, thinking through who is the audience that you have to communicate to, who should communicate, and what do you need to communicate and how. And I put this little carrier pigeon in here because it's hilarious. That's probably not how you want to communicate. I don't know about the ethics of strapping something like that to a bird. And then hardwiring the change, those reliability principles, making it easy to do the right thing, streamlining things, cues and prompts, forcing functions. Okay, and then a bunch of other resources in the slide if you want to continue your learning about sustainability concepts. As I said, there's lots of different frameworks out there. And with that, we have 1 minute left, so I've managed my time somewhat poorly. I apologize, but we do have coming up a quality improvement affinity group where we can reconnect on this topic of sustainability. The agenda right now is completely open. It's a drop-in call where we can talk about questions leading up to the learning session in December, anything else that you still have questions about, plans for the future, all of that stuff. And then of course on December 14th, we have the half-day learning session and harvest session, which is gonna be really fun. I think it's gonna be really fun. And we're gonna hear from a lot of different teams and just gonna continue the conversation on sustainability and actually start talking about some concepts for how do you spread your improvements in your organization. And then Wendy's been reaching out to talk to you about one-on-one interviews. We want to learn what successes and what challenges you've encountered and capture some of the stories that, that you've had. Okay, and Wendy already put the evaluation into the chat box. No, December 14th, unfortunately, is not in person. It will be virtual. Sad, but that is our current time.
And CVCH and Children's Home Society, if you guys could vote for the peer awards, that would be great. We can wrap those up and start our preparations for December. And if anyone has any questions, feel free to reach out to me. If you're having a team for the one-on-one evaluation, will you just drop me an email? Let me know who's on that team so I can watch for them, all your team members, to do the when to meet poll, unless you're doing it, you're filling it out for your entire team. Just want to make sure I get you all connected. And that was all. Thank you for joining us today. Thanks, Tina and Roger, Connie, and Kathy.
Thank you.
Bye-bye.
Have a great day, everybody.